Thank you, Leslie, and welcome and thank you, everyone, for attending today's virtual briefing, Evolving Payer-Provider Collaboration, What's Next on the Horizon, which is sponsored by CL Health Analytics. As Leslie mentioned, my name is Shelley Price. I am Director of Payer and Life Sciences at Higgins, North America here, and I will act as a moderator. Today's third and final session is titled Predictive Analytics, a Catalyst to Drive Behavior and Engagement in a Value-Based World. We look forward to your questions and comments, which you can submit at any time by accessing the question box on your screen, and we'll make every effort to answer your questions during the live Q&A at the end of the presentation. Our speaker for today's third and final session is Rose Higgins. Rose is President of CL Health Analytics, and Rose, please begin the presentation.
Thank you, Shelley. And thanks, everybody, for joining us today. I'd like to spend a bit of time here talking a bit about the analytic trends that we see emerging and we think are really quite relevant to the value-based care transition and transformation many organizations are underway with. There's a couple of key points to just highlight here. First of all, everyone is at a slightly different place in their journey towards really having an analytic-driven organization. And so it really is important to understand that level of frank maturity in terms of how to use analytics. But a few things that we think are really relevant to highlight is the ability to gather and aggregate and interact with a number of new data sources, which may not have been typically used in historical care delivery or in creating networks or any other kind of payer-based strategy. So this really begins a journey to allow for predictive and anticipatory analytics to be developed. Through the synthesis of data, then we're able to also begin to gain insights and inferences from that data and begin to make suggestions and recommendations, really this notion of prescriptive analytics. But there, again, increasingly we find that there's more and more data to be actually interacted with, and it comes in many different formats. So really having the opportunity to look at a natural language processing and text mining capacity really allows us to also get into a much richer state of data discovery. And that in turn leads to the opportunity to create new ways in which to inquire of that data through machine learning and different kinds of algorithm-based inquiry that really promotes data as a science and important, frankly, composite, if you will, of what needs to be occurring in organizations in terms of overall analytic competency. That really then creates the opportunity for more cognitive learning and cognitive computing opportunity and really creates a participatory analytic environment. All of this, we believe, is important in creating actionable insights to help support this transition in driving to value-based care. As we think about trying to understand populations, at the end of the day, all of the work that we do in value-based care is really around serving populations. Trying to find those particular areas where you have the greatest potential for impacting a population and truly delivering higher level clinical and quality outcomes, it's important to begin to look at the composite, but also being able to get down to the details of who those individuals are that create, that create that particular population or opportunity. And so, as we proceed, we want to look at a couple of different things in terms of creating an overall foundation for population health. And we like to think about this in terms of creating profiles of the individual, whether that's the patient or the member or the provider. And so it begins with really understanding the risk associated with the individual and trying then to take a look at different kinds of patterns which help inform that information around risk. And so looking at utilization, understanding cost and quality attributes, looking at clinical factors as they begin to have different kinds of bearing on the information as it continues to be built out. Looking at demographics and attribution, understanding the relationships, if you will, between the data and the individuals that are contributing to that data. Adding to that new kinds of information around behaviors and attitudes to give us a new perspective that we might not have had previously. And that really is what we use to create this robust and in-depth review or profile of, if you will, of the patient, the member, or the provider, all of whom are clearly important stakeholders in this discussion around population health and value-based care. So as we start down this path today, we wanted to take just a moment and get a sense of where you and your organization may be in relation to using different kinds of data to inform care models and programs. So we'd like, if you wouldn't mind, to begin to weigh in and give us your perspective on any one of these areas. Just take a moment. We've got quite a few folks that are weighing in. Thank you. Okay, we'll go ahead and take a look at our results. So we've got an interesting display here. We've got, not surprisingly, a number of folks that are still fairly early in considering the use of non-traditional types of data. We've got folks that are underway with implementing a variety of different types of data and multi-sources of data. Not as many in the advanced category, and again, not uncommon to find that. Depends entirely on where your organization is. And then a few that are just not clear yet on where you stand. So an interesting array, but not all that unique, frankly. As we talk to different organizations, we see this, really, frankly, quite varied review of where we are in terms of this particular progression. So thanks for that. So let's dive into a little more detail. When we think about populations, again, we have this very large set of information points, but how do we figure out where do we want to actually focus our resources to try to find a way to actually get clarity in terms of how we approach the problem and where we can actually get the greatest potential benefit from our interventions? And so we like to think about this as the lens of impactability. So you'll often find, and it's quite traditional to take a look at the stratification of a population, and you'll see that that population will array typically in a low, medium, or high range of risk. But going further to look into each of those particular categories and inquire, is there further delineation of that risk? And so if we do, for example, look at this high impactability, that 12% of our total number of members in the plan, we find that it does array again into a low, moderate, and high risk scenario. And so we then can really begin to focus on where do we want to take our attention and really begin to focus programmatically as well as individually on trying to address any particular needs in a population. So it gives us a bit more clarity, a little bit more detail on where we want to begin that particular focus. And so if we go one step further, another area that we actually can begin to look at is how that arrays. So now I've taken a look at this population. I've determined that I certainly have high risk. I've gone further to inquire and determine that there's additional risk within that population. Well, let me look and now begin to understand it in the context of condition and the impactability of that condition. And so how we go about bringing that data to light is really to begin to look at it in terms of the ease of impact or the complexity of impact and intervention. And so we can then highlight a series of opportunities, the financials in terms of the total dollars expended potentially around a particular condition. And so in this instance, if I were to highlight this large blue bubble, I understand it to be diabetes. And clearly within diabetes, there are a number of opportunities that we can use as intervention strategies to help us begin to take a look at that total dollar impact and begin to reduce that and hopefully as well improve the overall quality of outcome for that particular set of individuals who are composed of that particular group. And so we'll go a little bit further and then begin to understand, now that I know something about that population, how do I begin to understand if I'm actually beginning to reduce that overall expense and improving that overall outcome? So you've obviously got to be able to look at tracking compliance and progress of the individual over time. What's important to note that is it's often very critical to have a comparator. So having a set of benchmarks that you can actually refer back to and say, well, how am I doing? I may be moving the dial in my particular arena, but is that really comparatively where I should be if I look at a similar set of populations and a similar set of demographics? So it gives you a better perspective on whether or not you're actually at performance, below performance, or frankly above performance in terms of other benchmarks that are in the market. And so this is an important part of the journey we take our customers on, is really making sure that you're comparing so that you can adjust not only your own expectations and your program plans, but also tell the story as you need to your key stakeholders of your overall performance and progress. Important to note that obviously the criticality of creating a strong and trusting relationship between the patient and the provider is really at the core here. So it really is a situation in which individuals can only do so much on their behalf, providers can only do so much on the behalf of the individual, but bringing them together and where you have the opportunity to create that really strong engagement, you have the opportunity also to see really significant benefits accrue. And so as we think about how do we help provide more information to that provider to help understand how best to engage with that patient or how best to design a program, we look at some additional kinds of data that we can use to inform and educate. And one, for example, might be the addition of consumer-type data. So really looking at ZIP+4 type data and MFA-based data to help us understand more about that population in terms of how they actually behave as consumers. So increasingly, patients are consumers, as all we know. In the high deductible health plans and other kinds of different out-of-pocket situations, people need to be able to make decisions that are not only about their clinical benefit, but also financially sound decisions for them. And so knowing more about their consumer patterns and behaviors helps us tailor the way in which we might engage with them or outreach to them, or also design programs for them. So as we've been going through this discussion, we've been able to show we found these high-risk populations, we found the conditions that are relevant within that population. We now know a little bit about where we would actually try to intervene. We know that they're in a relationship with a particular provider, but do we know how they're going to actually be able to spend dollars and participate with us in the discussion of how that healthcare resource gets applied? So we look at this in a consumer segmentation model, and it gives us, for example, a high utilizer profile of this particular population. And so in that instance, I now have some additional characteristics about how that person is going to behave in the relationship and in the activities that we expect of them in terms of taking care of their own health or engaging with the healthcare system. So it's an interesting new set of data that we can use to help us, again, get more specific in terms of how we can actually bring our tactics and our approaches to bear. So now that I know a little bit more about that individual, I know that I have a high utilizer consumer segmentation model, I would then be able to take a look at utilization within that particular construct and see that in this instance, yes, that high utilization expectation is actually bearing out. So in this instance, I can see that the probability of ER admissions or IP, inpatient admissions, is fairly high with this particular population. And so if I can go ahead and find a way to reduce that utilization, because I know that that's the pattern or the behavior that I should expect for this population, I then have the ability to begin to target and specifically think about how do I work with this individual to intervene in a meaningful way? Well, the first thing I want to do then is take a look at this individual who has a high risk score, so again, that initial risk analysis, but also a high impactability score. So again, we've taken that next cut and looked at that data and said, this individual is really someone that if I take a very targeted approach, I can see a very potentially significant improvement in the overall utilization of things like ER or inpatient admission. And so simply by focusing in on the type of gaps that will be relevant to this population, I can really focus in on a reduction of upwards of 70% in this particular utilization profile. And that is really quite meaningful when you begin to additively look at that across a population that has similar demographic and behavior attributes. So the other side of this question is, of course, how do we get people to actually comply and adhere to the programs and really engage with us in trying to actually improve their health and ultimately reduce the overall expense associated with the management of that individual? And this is an example case in which we were able to apply, again, all of the analytics that we've talked about thus far during our session, but also, again, take it to the next level of saying we know something about this population and the way in which they engage. So if we provided a set of incentives that would allow them to accrue points that they could then determine how to spend against a set of programs that have been defined for them by the payer, then they have the opportunity not only to benefit from that in terms of improving the overall quality of their health, we see a tremendous improvement in the overall rates of compliance to the various types of preventive and well management strategies that we've been discussing. So these kinds of interventions are only useful, of course, if we can have the individual participate in those. And so as you can see, by bringing nominal types of incentives that are meaningful to that population, we're able to drive these compliance rates really significantly over time. And so this creates that true level of engagement with the individual and a value, if you will, for their participation that they can actually see and accrue and act upon. So do we also see an impact then in terms of that expense profile? So if I'm making this an investment in a population and I'm actually beginning to see that compliance rate, am I also in turn seeing an improvement over the overall rates of utilization, which we had highlighted earlier might be potentially problematic for this type of population? And so for those individuals that are non-participants, we can see that their inpatient PMPM is sitting at $354, whereas for those individuals who have participated in the program over time at increasing levels of point accrual, then we actually are also seeing a reduction overall to $106 PMPM in the inpatient sphere, and a similar reduction in the ER experience. So this is really meaningful dollars. It's the actual ability to see the individuals participate in their care, get that preventive and well management, and as a result also see really significant utilization impact that is an improvement overall for that population and that individual. So there's more to be had here in terms of helping the provider. We've talked a bit now about how do we engage with the patient or the member and get them to actually be doing their part through the use of these kinds of analytics. But in addition to that, we want to provide visibility to the provider on ways in which that they themselves can also know what needs to be done and at the same time be benefited through the improvement of overall coding strategies that will return dollars back to the organization. And so this is an example of a health assessment report that would be generated based on data that we have about that individual and that provider. So those patients in attribution and relationship to the providers, we have the ability then to actually look at what work has to be done to meet the overall types of guidelines in terms of HEDIS or STARS or other metric managements that we need to be complying with. And in this instance, we highlight for this particular population with diabetes, we do see that there isn't proper HCC coding that has actually been documented for this individual. And as a result, there's two things that are happening here. One, first, we're not getting that quality metric captured and obviously reflected in the care of the individual. But similarly, we're leaving dollars on the table that would be appropriate to flow back to that provider organization for really delivering the highest quality care for that individual. So it's a win-win in that regard. So if we look at that in terms of how would that translate, these kinds of small improvements really can carry significant revenue implications for the organization. So in this instance, if we have this population who actually has this kind of data that is outstanding and needs to be captured, there's a loss of dollars to this practice. And so in this example, we can actually show you that by having that individual organization capture that data, we can raise the risk, the RAF score, and as a result then see an additional flow of dollars and revenue back to the practice. And so when we look at that, we see that this is an improvement for the health plan because obviously this increases the overall quality scoring and makes them, frankly, a more competitive player in the market. And at the same time, the providers are being compensated appropriately for the highest optimal care that can be delivered. And so these, again, are win-win scenarios that are really being delivered through the use of analytics to support that overall identification of those opportunities at the patient or member level, the ability to support the engagement with a provider by giving them information they can act upon, and then also realize that financial benefit and improvement back to the organization and the key stakeholders. So again, a win-win scenario across the board. As we look at just a case example here, again in a value-based world, and ACO of course being one of those prevalent models, we're really taking a look at all of the kinds of data, all those different kinds of data sources that we've been discussing, bringing that all together in a way that allows us to really understand what is truly occurring across the 360 view of that individual, where care is being delivered, what kind of care is being delivered, what kind of data is being captured or not captured on behalf of that individual, having us begin to understand the overall utilization and quality profile of that particular individual, applying the ability then to understand through, again, analytics and other kinds of data attributes, how we can begin to engage and activate the population to be more directly involved in the management of their own personal care, and thereby improving their overall health and their quality, and at the same time we begin to see the ability to reduce costs and drive that inappropriate utilization out of the system. This can obviously be measured in a number of different ways, not the least of which are the various types of quality metrics, which are important for not only regulatory purposes, but also for being able to really tell your story in terms of how your organization is caring for these types of individuals and, frankly, getting the job done. And as a result, increasing your ability to attract additional contracts that will be successful for you, and you will have a better sense of the populations that really you are best suited to manage, and for you to be able to expand your reach with respect to. So this is an example of all of that in action, where we were able to see a diabetes management program really deliver good value back to the patient by seeing those overall reductions in those critical clinical parameters like LDL and A1C. We have compliance there in terms of getting the measure done, but then also in seeing that those values are going in the right direction. Increasing the utilization of primary care versus participating at the ER or inpatient admissions, really seeing again that inappropriate utilization being translated to the right vehicle for the delivery of that care, and having the opportunity then to enhance that most important and trusted relationship between the physician and the patient to really make sure that we have a good dialogue that will persist those improvements both in the behavior of the individual but also in the best practices in terms of quality of data capture and the ability to demonstrate that and return value back to the practices as a result. So all of these things then come together in creating a set of information points that can really deliver good value back to all the key stakeholders. So really, as we think about this in summary, the notion of what we shared today is the use of this kind of predictive analytics to help you begin to think about where is the right place in your particular journey to begin. Where do you focus? Where do you apply the key types of resources that you have available to solve for that problem? And to frankly also highlight opportunities that you may not have seen before in a more detailed way, so that your focus, your precision, your ability to be active in working the problem is certainly improved. And as a result of that, we begin to see a higher level of engagement, we see a higher level of participation, and that obviously results in the types of sustainable result that you want to see over time. And ultimately, at the end of the day, this is about lowering costs, but also, frankly, improving and bettering care. And so with that, I think we have time for a few questions. Hopefully, folks will have a few for us. Thank you.
Rose, yes, Rose, thank you so very much for an incredible, informative presentation. Great capstone to the series today. We do have time for a few questions. We already have several in the queue, but please feel free to continue to submit your questions into the queue. One of my first questions, Rose, is, you described that predictive analytics is really key to new value-based programs, but it seems like we're still, as an industry, struggling with that type of analytics, still even trying to get our arms around descriptive and retrospective analytics. Could you get into prescriptive analytics, explain it perhaps a little bit more in the context of these value-based care models, and maybe give a few more examples for our audience?
Oh, sure, Shelley, thank you. So great question. As we said, we've spent a bit of time talking about these various kinds of analytics, but what we mean and what we see in the use of prescriptive analytics is really adding all of these pieces together so that not only are we identifying the opportunities, so we're predicting where we can find that population which can be improved, we're predicting what that individual risk is and how we may be able to further refine that by looking at the impactability and the intervenability of that individual and tailoring along the way. The move to prescriptive is really to say that when you do that, here is really the real-world evidence or the best practices that we recommend that you follow as well. So it's taking the journey one step further to say, based on the evidence and based on the particulars of the analytics, understanding again that population, that impactability, that intervenability profile, we recommend the following. And so these are kinds of programs that we have done for lots of organizations where, for example, they may want to look at care redirection. And so we can suggest that based on a set of analytic profiles of the patient and the member, these are the ways in which we would direct that care. We would suggest perhaps that this is something that doesn't require a surgical intervention at this point. Perhaps it's more of a medical type intervention that is more appropriate, or perhaps something like a therapy intervention. So there's ways in which to look at it, both from a surgical process or a medical process perspective. But what it does is call upon the evidence, marry that with what we've seen as best practice that frankly will deliver the kind of outcome that you're looking for, and then matching that to the predictive profile of the individual and the population. And so that's really what we mean by prescriptive analytic. And I think it's one of the most exciting places, and honestly, as we talk to our customers and many different organizations that we work with, they have really said that this is where they see the journey taking them. They need to be able to be very specific and precise in their approach, and this helps them do that and also preserve resources that they would be spending perhaps without the proper return on those resources.
Wonderful, thank you. You also spoke to using non-traditional data to helping providers understand their patient populations in order to support patient engagement and improve population outcomes through some of your previous slides. And then to the polling we saw earlier, that indicates that the majority, at least of our audience, could be a representative of industry in general, certainly in the beginnings or the early stages of using these different data sources to inform care models and programs. Can you speak a little bit to what are some of the challenges or solutions to data sharing and aggregation for prescriptive or even predictive analytics for these new care models?
Sure, and I think it's actually one of the big hills to climb when you get started on this particular path. You've got to find your way to the relevant data in order for you to be able to have a chance at doing well in this. So, clearly one of the arenas is accessing that claim data, but that's going to give you only part of the picture. So it's adding to that the other kinds of clinical richness that comes from different kinds of clinical factor data, whether that comes from an EHR or some other kind of assessment vehicle that then we can use to inform. We can certainly add, of course, any kind of RX or prescription data. That's obviously hugely helpful, as well as adding to that the kinds of data around any kind of behavior or attitude that the individual may have. So what that does is really begin to allow you to incrementally move your program forward by being able to add new elements to the program. So just getting started with getting the data through the proper conversations and making sure that you can begin to acquire and aggregate it will begin to give you really good insight yield to help you understand what's occurring. But when you are at a certain point in your journey, when you've been able to merge the clinical and the claim and the RX and the lab, really recommend that you start looking at that other type of data that's out there, which is really around behavioral pattern and consumer behavior pattern. That really helps begin understanding in a segmented way the particulars of your marketplace. So where you sit really will help you understand what the population in your particular geography and marketplace does. How do they behave? So it doesn't make a lot of sense for you to spend money in a certain way if you aren't able actually to tip the dial in your particular direction, because your population in your area isn't going to behave in that way as based on their historical consumer or socioeconomic behaviors would suggest. So again, it's a journey. Start by thinking about what you do well. Look at the data, begin to understand what it's telling you. As you have the ability to add more data to that, absolutely do, because the further down that path you get, the richer the data, the greater the analytic potential for you, and therefore the greater precision, targeting, et cetera, that you can apply to the problem.
So thank you. I think you also answered, how do we get to the right data and how do we also get to the right patient and population through consumer segmentation. We have another question from the audience around change agents. Now that we have the data and we have knowledge of the patient population at segmentation, Who then do you think is the primary responsibility for patient outcomes? Are we talking about the payer, provider, the patient? And then how do we use these data and these analytics tools to bring them all together?
Great question. I think the key is that there is no one party who is more important than the other in this particular respect. I think there remains a fair level of skepticism, and appropriately so, on how we can actually influence the patient, the individual, to really be an active participant. And so I think there are examples, certainly as we shared today a little bit about incentive approaches. There are many different ways to actually provide nominal incentives to support that behavior change and sustain that behavior change, which is really the other key issue. I think that we've seen, certainly in our experience, that having the provider front and center on how this is going to be implemented, taking that experience and that relationship trust that is there is really critical to helping to persist the behaviors as you go forward. But at the end of the day, you also need support from the health plan partner, because these are programs and initiatives that oftentimes need to wrap the kinds of work that is done by the provider in their day-to-day operations. And in fact, we just had this conversation with our Strategic Advisory Council yesterday about the importance of that wraparound and how do you support the patient and the provider without having to interrupt or disrupt the work that they need to do together in order to be successful. So I really do think, and we believe at CO, that it's really all of the stakeholders at the table working jointly in the right capacity to support one another to receive and benefit from these mutual, I think, win-wins.
So thank you. Very good answer, and I think it also wraps up not only this session, but this series as well, looking at data and information and payer-provider relations. So thank you to all who have submitted questions. Unfortunately, we are out of time today for a session. We'd like to very much thank today's virtual briefing sponsors, CO Health Analytics. We trust that you found this event educational. Please be sure to complete the evaluation and share your thoughts with us about this series and this segment. On behalf of HIMSS, I'd very much like to thank Rose Higgins for taking the time today to share her expertise with us. Today's session and all the other sessions will be available on demand through October 27th, and this concludes today's virtual briefing. Thank you very much and have a wonderful day.